Hello and welcome to the CAPE training program. My name is John Leatherman. This is the second of 3 videos introducing the CAPE training program. CAPE is short for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. This training and related activities was sponsored by the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, and the USDA network of regional rural development centers. The objectives of the program are to enhance behavioral health literacy by offering the Mental Health First Aid Training Workshop. Our second objective is to motivate the creation of community coalitions to address local behavioral health needs, such as the opioid epidemic. Finally, we are encouraging the notion of formal action planning to create a community roadmap for improving the local situation. In this video, I'll provide additional information about the Mental Health First Aid Program. As a qualifier for this video, I am not a mental health expert or an expert in the Mental Health First Aid Program. To help me talk about mental health first aid and ensure I characterize the training correctly, I draw from the training manual, Mental Health First Aid USA, the revised first edition for the adult training. In parts of my presentation, I will read verbatim excerpts from the introductory section of the manual. To meet the objective of enhancing participants' behavioral health literacy, we chose the Mental Health First Aid Training Program. It is an international training program with considerable research evidence that it fulfills the promise of enhancing behavioral health literacy. It is built around the idea of applying a first aid kit with application to mental health. The basic training is a 1-day, 8-hour in-person training. There are several versions of the training available to deal with adult mental health, youth mental health, and other specific populations. For this training, we'll be using the adult version with a heavy emphasis on substance abuse disorder. Mental health first aid helps participants to recognize the signs of behavioral health distress and to know what to do to be helpful when they see it. It also helps to address broader behavioral health challenges by reducing the stigma associated with mental health and substance abuse problems. Completion of the training provides a certification for participants, and that may be helpful for some people. We'll begin by looking at some of the mental health problems in the United States. Mental health can be thought of as existing along a continuum. At one end of the continuum, we find people who are experiencing very good mental health. At the other end of the continuum, the individual is experiencing one or more diagnosable mental health disorders. Most of us exist somewhere in between these extremes. Hopefully, it's closer to the healthy side, but most people sometimes slide into the area represented by some level of distress or problem. According to a national survey by the Substance Abuse and Mental Health Services Administration conducted in 2013, some 18.5% of U.S. adults will experience some type of diagnosable mental disorder in any given year. Certainly, there are people who stay on the list year after year. For others, it is an acute situation from which they achieve relief. Still, the probability that 1 in 5 people experience such distress means that the problem of mental health is very widespread. Mental disorders often start in adolescence or early adulthood and may persist for a lifetime. This can be extremely disabling for the individual, which is why it's important to identify it early and get the person treatment and support. Unfortunately, mental disorders are frequently unrecognized and misunderstood. We may not appreciate the severity of distress when we see it. We ourselves may feel too ashamed to admit we have a problem and need help. We have interventions and treatments for dealing with mental health disabilities. Obviously, we would prefer prevention of what is avoidable, such as at least some types of substance abuse. If a person begins experiencing mental distress, we might hope for an early intervention and treatment to speed the process of recovery. The Mental Health First Aid Program is intended to have impact at early intervention stages. It's thought that if more people could recognize distress when they see it and know how to be helpful, it might help avoid problems and hasten recovery. Let's look at some recent trends related to the opioid epidemic that has ravaged so many communities. This information came from the U.S. Center for Disease Control. This is the rate of drug overdose deaths by state in 2014. The darker the color, the higher the rate of overdose deaths. This is the rate in 2017. Research published early this year projects that the deaths associated with opioids will more than double from the current rate by 2025. Synthetic fentanyl is a particular concern because of the ease with which it can be illegally produced. These are the number of reported law enforcement fentanyl encounters by state in 2013. This is what it looked like 2 years later. Here you see the rates of death by type of opioid over time. Once prescription opioids began to level off, heroin use picked up. When the fentanyl hit the market, it took off. The bottom line is that the problem is getting worse. Last trend slide I'll show is in relation to rates of suicide. Suicide has been increasing almost everywhere for the last 15 to 20 years. There are about 45,000 suicide deaths per year in the United States, and the trends are not encouraging. If we recognize warning signs for these types of problems and know what to do, we can hope to temper some of these trends. That is where mental health first aid training may be helpful. Why do we need something like mental health first aid? There are a number of reasons. Mental health problems are common, and many people are not well informed about mental health distress. Many who have mental health problems do not seek help or delay seeking needed help. There are stigmas associated with many types of mental health problem. People may not know they need help, and finally, professional help may not be available when a person has a problem. Mental health first aid offers a 5-step action plan to use when encountering a person experiencing distress. First, assess the risk of suicide or harm. Second, listen non-judgmentally. Third, give reassurance and information. Fourth, encourage appropriate professional help. And finally, encourage self-help and other support strategies. At the workshop, you'll learn how to use this action plan when you see developing problems or in the event of some crisis intervention being necessary. In our final introductory video, we'll focus on the community development side of our training program and the CAPE Community Action Planning approach. I'll share an example of an action plan for creating and sustaining a local coalition. This is one of the tasks we are asking you to consider completing for your communities. We'll meet by webinar thereafter to answer any questions about the training that you may have. Here is our contact information. Thank you for watching.